Okay.
If there are ticks carrying Lyme disease in these parts, Merlin here would be infected long before his owner.
In their armpits, anywhere on the belly. So these are the parts the ticks are going to get to the body.
Dr. Scott Weiss is a veterinarian and professor who's tracking ticks.
We see this area in Ontario is our highest for Lyme disease exposure in dogs.
Pet Tick Tracker is a surveillance study. As tick populations grow and expand, pet owners can go online, identify what they've found, and submit that information.
Dogs travel a lot more than we suspect. Come on, cross.
They also undergo routine testing for Lyme disease, offering records going back decades. Weiss says all of this dog data acts as an early warning system.
So we can link what's going on in dogs with their exposure to what's going on in people.
So what is going on with people? The number of ticks carrying Lyme disease is steadily increasing. So are the number of reported human cases, going from 144 in 2009 to more than 1,400 last year. Most of the infections were in Nova Scotia, Ontario, Manitoba, and Quebec. Typical symptoms include fever, fatigue, and a skin rash. Left untreated, the infection can spread to joints and the heart.
So this is what we use to collect ticks. It's a cotton flannel sheet.
In order to warn the right people, public health officials need to know exactly where the bloodsuckers are. Scientist Nick Ogden notes ticks thrive in tall, grassy, wooded areas with smaller rodents and deer. And it looks like he's found something.
This is an adult female tick here, and this is a nymphal tick.
Or a baby tick. Ogden says while the risk of Lyme disease is growing, it's still low.
With appropriate knowledge, the public should feel empowered to manage that risk.
Lyme disease is preventable. If you're in a risky area, cover up, use bug repellent, and check the skin afterwards for ticks. If you think you've been bitten, go see a doctor.
So they are moving now.
Critics have argued doctors aren't ordering enough Lyme tests or that they're not accurate. Dr. Mohammed Morshed says the tests are gold standard, and 6,000 samples were tested in BC alone last year. The next frontier is a vaccine.
But I think that is still not there, but there are some animal vaccine available. But for human vaccine, people are desperately working on it, so we might be able to get good news within 3 to 5 years.
For now, Dr. Weiss says Canadians shouldn't avoid venturing out.
There's always some risk in life, whether it's on the subway, walking down the street, or walking in the woods with your dog, but we can reduce those risks.
Merlin certainly doesn't want to be cooped up inside. Christine Burak, CBC News, Guelph, Ontario.